a consultant urologist, Dr. Daou, Gdeh, both from Sidilega Hospital. We will also discuss the importance of creating supportive environments and educating the public to correct misunderstandings about infertility. Good evening and welcome to Botswana Tonight.
Nice to meet you.
Good evening, Comrades.
Now, we talk, I think this is quite an important conversation to have. We've just seen over the past couple of days the Merck Foundation, in partnership, of course, with the First Lady, Masisi, really speaking to demystifying infertility, speaking to having that support, and, of course, challenging in the media to do, the right things in terms of reporting on some of these. So when we start our conversation, perhaps let's just talk about the misconceptions, the societal issues that in your area of expertise you find. I'll start with you, yes. Dr. Gdeh.
I think, first of all, they should understand the definition of infertility. What is infertility, So we always define infertility of when the couple decide to have a baby, the conception can take up to 12 months. If the conception doesn't happen after 12 months, then it means there's something going wrong. And during those 12 months, there must be no interruption. Like, for example, if the husband is traveling for 1 month and he come back, then there is So some patients, after 1 month or 2 months, conception doesn't happen, then they start stressed and they think something going wrong, and people, they start, asking why the pregnancy is not happening, and then that put more stress on them than they come to the doctor. So I always try to reassure my patients, no, wait up to 12 months. If the 12 months passed, then there must be something wrong.
Okay.
Yeah.
Dr. Ndiwo, Memo, for you, what are some of those significant societal misconceptions that you find in your area of expertise?
Yeah. Thank you very much, Comrades. I'm a gynecologist, meaning that my patients are female. And unfortunately, there is a myth that every time when a couple cannot fall pregnant, it's the woman's fault. But I've always said that it's criminal for any doctor when they are dealing with infertility to only concentrate on women. Because this is a couple, and the failure can be from both or from one of either of them. So now this misconception that females are the ones that lead to infertility needs to come out and be discouraged. And men should also take responsibility in terms of the fertility of the couple.
Okay. How do we find, I like that you talk about the misconception of quite often thinking it is the woman who's having infertility issues. I don't know, where do we think this emanates from? Is it because women just talk about their issues and men don't? Why do we find ourselves with this misconception? Is it traditional? Where does it come from, doctor?
It comes from the culture, yes. I originally come from Arab culture. We have the same mentality, When you talk about man, they think how he's strong. And, if you tell him you can't have baby, that means you are telling him you are a weak man. You are not man, So I think it's the same thing, That's why we always blame women. But this misconception, I think, by the time now they are disappearing. Because the media is explaining this, we are trying to explain on Facebook and other websites, people started to understand, yes, it can be 50-50, it can be man or woman. We have to investigate both couples. Yes.
But in your line of work, where do we find, is it even a right or an ethical question? And this proves that the media also needs to be trained. Do we find the most cases of infertility?
Yes, I think if in my clinic, if I get 10 patients, one of them, they are complaining about their lack of being able to conceive. So it is a problem. And you would know that women, culturally, women were meant to stay home, to be nurturers at home. And I think our culture has put it that women are meant to to bring babies to the family, which is why now when there are no babies in the family, we tend to blame the women. But it's not always the case.
Now, moving forward, we understand it can affect both parties. Moving forward, what then do we need to do? Now we're talking about mental health issues. What then does society need to do to ensure that we understand and we actually provide the support to either or?
I think we should start having, a supportive group, from previous experiences. They should engage in a supportive groups. Social workers, they have to wake up and start raising the education to the people, going through the media, explain what's happening, what's the solutions. We have to support them. We should encourage that there are a lot of treatment that can solve the problem. We shouldn't stop thinking of having. There is solutions. They should come to us, and it will be sorted out.
Okay.
Yeah.
I think it's quite important that we talk about solutions, we talk about treatment. I want to believe infertility is an illness like any other illness that can be treated. Speak to us about some of the treatments that are available.
Okay. No, firstly, I think there is a woman is more complicated than men in many ways. A man is always ready because the men always carry sperms that are ready to can fertilize an egg. But unfortunately for women, they only produce an egg once in a month. Now, the timing of sexual intercourse needs to be timed at a time when the egg is being produced or around that time, which makes it very, very difficult for couples that stay apart to now have to time their visitations around this ovulation time. So now we need, firstly, because a lot of the time when you investigate these couples, a lot of them, they will come out with everything being normal. And the problem is their timing of sex. If it happens outside the time that they are fertile, they can never fall pregnant. So it's one of the misconceptions that every time a woman and a man meets, there's possibility of making a baby. But an egg averagely would last a day or two. So now if you miss that window, the rest of the time, and no matter how much sex you can have, they will not fall pregnant. So we need to start there. The second thing is that I think now we know women are choosing to be career women, and age is a factor. A woman is most fatal between when they are in their late 20s to the early 30s. Now, if you calculate, you would see that a lot of women, they would want to catch up with their career, and then by the time they want to start, their fertility has dropped. And now they struggle to fall pregnant, sometimes not necessarily because they cannot fall pregnant, but because of the timing, because of sometimes they don't ovulate. And the treatment itself is to make sure that from the woman point of view, they can ovulate and produce an egg that can be fertilized. From the men's side, they also have sperms that are healthy, that they can swim and it can fertilize an egg. So most of the time, these infertility issues, they can just be solved without going into any advanced technology. But however, because I've said that for a couple to fall pregnant, we need a womb that is healthy. We need tubes that are healthy, that can transport an egg from the ovaries into the uterus. And then we need a healthy sperm. So now, if any of those are not well, now that's when you would need advanced technology, which is IVF.
Let's just hold it there. Before we go into the advanced technology, let's just say, you say all things being equal, you need a healthy sperm, you need a healthy egg. What then do people need to do because we take it for granted that I'm not sick, I'm okay. What do we need to do to ensure that we have a healthy sperm and we have a healthy egg?
Simply, you just need to come to the doctor and explain your problem, and then immediately we start investigating simply by doing the sperm test to see how healthy is your sperm, how many sperms the guy has, and then if needed, we also sometimes we do the hormonal profile test, so we can define where is the problem exactly, and then sort it out. Sometimes simply it's just varicose veins around the testicle. We know the varicose vein, they increase the temperature in the testicle, then the sperms become weaker. So simply we just do a simple operation and we remove the varicocele. We call it varicocele,
Okay.
you know? Yeah.
Dr. Memo, I'm going to ask you this question now. What do I need to do to have a healthy sperm and without coming to the doctor? What do I need to do?
You know, I'm going to steal a definition that I recently came across when I went through counseling somewhere. She defined health as the ability to adapt and self-regulate when you are faced with social, physical, emotional, spiritual challenge. So now, a lot of the time as couples, we have our problems outside fertility issues. So now you need a healthy woman and a healthy man for them to be able to produce healthy sperm and healthy egg. Just emotions alone, they can make a cycle of a woman to not be regular. So now all these social ills, all these spiritual ills that couples go through, they can make them to be unable to fall pregnant. Because like I said, the timing for sex need to be timed. It's just within 5 days. If in those 5 days it's not you are not happy, and women tend to say or a man is also not happy, comes back from work, they are grumpy, then they don't have sex for those 5 days that are critical, then it means they're going to struggle to fall pregnant. So the healthy home would most probably make them to be able to produce healthy sperms and healthy egg, provided nothing else is abnormal.
Okay.
Can I add something also? Yeah. Don't forget about the healthy food. Avoid the bad habits like smoking, good exercise. They really improve the quality of the sperms, you know, because there's something called free radicals that runs in the body. And if we eat healthy food, then we have less free radicals. And free radicals are known to break the normal cells, including the sperms.
I think now we've sorted what we need to do to create that environment. Let's talk about now it's been established through your tests that, okay, this is not a healthy environment issue where we can say go back and maybe go for counseling, for example, deal with your stresses. Now medically, we find that there is a problem here. We're talking about the fact that there are solutions. You were going into the advanced technologies.
Yes. So like I said, when a couple comes, we investigate them, and if you come out and say, you know what, there is no problem with them, then they need to keep calendars, they need to time their sex, and then you give them time to can conceive naturally. Sometimes you might find some things that can be corrected, and then they can go ahead and conceive naturally. So now if for example, a woman's cycles are not regular, so they don't ovulate every month, then you can induce them to ovulate, and then they can conceive naturally. But then you might find at times, we find conditions that that inhibits them to can conceive naturally. Let's say maybe tubes are blocked. So if tubes are blocked, it means that the egg cannot travel from the ovaries into the uterus. Then that's when you'd need advanced technology like the IVF, where an egg and sperm are harvested, and then they are made to meet outside the body, and then they are then implanted into the uterus.
Okay. Now, I'm just curious to find out, now that we've established that there are conditions where this is a medical condition, and obviously it's beyond anyone's control, like in most cases where there are medical situations, what do we then do, or what do we then say to the rest of the community in light of the stigma that comes? What do we say to the community?
All of us, we need to be supportive to this couple. We should give them the advices. We should give them what other experiences from previous couples how they can solve the problem. They shouldn't get stressed. They should wait. They should be patient. Sometimes it takes time, but finally it will be sorted.
So I want to say, you know, in life we lead different lives. If a couple now goes out and gets married, socially the expectation in society is that in the next year or two they need to be pregnant.
That's what is
yeah. Now these are the things that makes couples that then fail to fall pregnant to feel that they are stigmatized. So now if a lady is born without a uterus, we both know they would never be able to bear their own child. But then now, what happened to the culture that we had, that was there back in the day, when we knew that there are women that could not bear children, but they had kids. Their families would give them a child to raise, and then the child grows up as their child, and we used to to be able to live with each other, knowing that they are unable to conceive. Even us as men, when a man had a problem, other men they found ways of helping. But now, obviously, in this DNA age where there are a lot of diseases and all that, it might be difficult to do that. But there are other means. There is surrogacy where another woman can bear another child's woman using their egg or using the woman's egg. So we need, as a society, to come to terms with the fact that not every woman will be able to fall pregnant, or not every man will be able to make a woman pregnant. And we accept each other. Like I said, when we have a healthy home, when we have a healthy ward or a healthy village, it will make the whole country a happy country. And we accept each other with our faults. If we choose not to have kids, even if we are married, then it's our choice. Let not Matsale now start pestering this woman that I found myself, and we've agreed we are not going to have any kids now because either I brought another child or they brought their child. Let it be accepted that it's how we want to. And ourselves, we should not put ourselves under pressure to live other people's life.
I think it's quite interesting that the both of you talk about the support and the support structures that are there. Perhaps when we look at from a mental health perspective, yes, we do have instances where they would even say perhaps you must look next door because there's the next door house is proving to be quite fertile because there's grandbabies everywhere. Maybe you must take a second wife or divorce and marry next door. But what I'm trying to find out here is, but from your experience, probably from your hospital, are there any support structures to just support the mental health? Are there any support groups? You made reference to families that have gone through this experience to support others, to ensure that people don't get even more stressed, people don't get even more challenged health-wise.
To my knowledge, we still are behind. We still have to push and get such structure. In general, treating infertility need what we call it multidisciplinary team, and most importantly is the psychologists, the social workers. They should be involved. It's as important as the medical treatment to support the couple, to ensure that the treatment will be done. It takes time, and just to reassure them, it's very important. Again, it will create a healthy life, healthy ovum, healthy sperm, if you are psychologically supported.
Okay. Let's just speak to the treatment or the support that you then provide. Coming from Sidilega, I'm assuming a medical aid is required. Are these treatments easily available to those who don't have the means? Is it something accessible to those who don't have the means, or is it something that it's only for the privileged?
That's fertility is one area that I must say is neglected. Because even when you have a medical aid, there are some conditions that would not be covered by medical aid. There are some procedures that are not covered by medical aid. This tends to be very expensive, even for those with medical aid, because now they have to be paying cash. And a lot of, we leave a lot to be desired in terms of getting the support that people with infertility needs, in terms of financing and in terms of the psychological part that he was talking about. I think we can still do better.
Okay. Dr. Gdeh, as we come to the end of our conversation, the role that the media and influencers and leaders, of course, can play in creating empathy and understanding for those that are having issues of fertility.
Absolutely. The media will open fields to us, to show how the solution is easy, it can be fixed. It's another psychosocial support to the couple. Yes, absolutely. It will increase our knowledge around the problem. It's a disease.
Thank you, Khumzo. I think I want to thank you for having us in this program. I think we need more of these talks that we can make talking about infertility not something that is hidden under the carpet. It should come out so that even women out there who might be going through experiencing some of these things that we are talking about, they might get a knowledge from that, and things might change for the better.
Thank you so much. We were speaking to gynecologist Dr. Ndiwo Memo and a consultant urologist, Dr. Daou, Gdeh, both from Sidilega Hospital, speaking to us about infertility, basically saying it is a medical condition that affects both men and women. But of course, there are processes that you would have to go through to really determine if you are having infertility issues, or if you just need some support, some guidance for you to be able to conceive. And of course, talking about the all-important support from those that are around you, from the community, that there's absolutely no stigma that should be associated to this, as it is a health and a medical condition.
Let me just share the objectives of this initiative, which is afforded or accorded African First Ladies. The first objective is to empower women who do not have children, who are infertile or childless. And how are these women empowered? They're empowered by being informed, educated, and where we try to tell society not to stigmatize them. And how do we tell society? It is all in an effort to ensure that there's a shift in the mindset. And how do we ensure this shift? We ensure this shift through our conversations. We try to get media to send out messages that are saying, do not stigmatize.